Hello, everybody. Welcome again. Now, I wanted to say thank you because we have several questions where the people, all the public wants to hear about what is the relationship between the hormones and dental care. So let's start. Hormones are, as we all know, they play a very important role in our life. What does it mean when it's the dentist? What it has to do these hormones with the dental care? Well, I was able to write a paper in a relationship for hormones and dental care when I was in my second specialty of endodontics. And I wanted to tell you something very important that I didn't realize that people doesn't have a clue. What happened when your kid is growing up and goes to puberty? Here he's in puberty, the gums are very inflamed and we don't know what. Well, it's an increase of the circulation in our overall system. And the kids, when they start getting excited because they like the girl and they start the sexual attraction, the physical attraction when there's an adolescent, they start also increasing the circulation on the mouth. And what does that mean? If they're not cleaning their teeth correctly and brushing correctly the way I teach them in another episodes with the technique I explained to you, then what is the first step that you're gonna have, from having a normal tooth where you have the bone here, you have your gums, these are the roots, and you don't brush, and then the adolescents come and you're gonna have inflammation of the gums and you stop brushing, then you start having accumulation of plaque like this yellow piece. But if still the brushing and flossing is not enough, it continues to create not only gingivitis but periodontitis, and then you start having breakdown of the bone because the calculus goes inside the gum. I'm going to show you the reverse of this model and start destroying the bone to the point until you lose the tooth. If you see this space, this is called furca. And the furca is this space that is in between the teeth where they are like the less standing. But when it's uncovered, it's because it's a serious problem with the bone of the tooth. After that, your tooth will break down. And similar things happen when you have an occlusal trauma, when you're chewing, biting, or grinding your teeth, and you don't have a protection. So when you look at this in the reverse side, and we look at the gums look, usually pinker than this. This is to red, this model. But then we see the plaque and start getting more red. Then we see space, the gums start getting destroyed, the bone start getting destroyed, plaque continue accumulating, becomes a calculus because it absorbs the calcium of the tooth, and it gets so hard that it has to be removed by a dentist. Usually you have to pay a lot of money for this type of cleaning because it's called deep cleaning. And why you want to suffer that when you can avoid all this by brushing and flossing your teeth? Then the other stage that we have is, and this happens, of course, in the men and women. And the other stage is the menstruation that is mainly for women. And during the menstruation, the woman is going to have the same problems that the gums are going to get inflamed. And on top of it, they can have something that can appear like a tumor that happens together with pregnancy. During pregnancy, you will see an image on the program. But right now, I tell you see like a little rounded yellow overlapping horrible reddish tumorish part that looks like inflamed reddish and is bleeding. How did you fix it? With brushing and flossing. What is the other stage? First we said puberty, then the menstruation with the girls, then the menopause. And menopause, woman goes also to stages where the mouth gets very dry. And when the mouth is dry and there's not the correct brushing, what is going to happen? You're going to start having a cavity of this size. It can be a cavity and a small cavity like this one, but then it start increasing more and more. And if you see it, you're going to be very lucky that you see this is a black stain on the tooth. But when you don't see it, sometimes it's hiding and it's on the side of the tooth. And then when you see this tooth on this side, you say, "No, I don't have anything. It's just a little thing," but that's not a little thing. This already, the consequences of this is it gets to the nerve, and when this decay, it's in the nerve and it affects the bacteria gets here, it becomes an infection of a size that is gonna go to your bone space, to the brain space, and then it can cause septic shock. So you don't want to get to this infection that we see in this model or this model. Sometimes the patient says, "I don't even have any pain. Why does this look like this?" And if you get to the point that there's no bone and there's destruction and we cannot save your tooth, what you're gonna have is extraction. And once you have extraction, then you're gonna end up having an implant or a bridge when you don't have the money for an implant. Now, these implants, keep in mind, they tell you it's from $2,000 to $6,000, and then they charge you for the abutment, then they're gonna charge you for the crown. And what is gonna happen? Still is gonna fail because you're not taking care of your teeth correctly. Woman, when it goes to the pregnancy and goes in the depression also, the hormones start getting stable, but the patient is depressed. During menopause, they have to be treated. And I'm very lucky to know Dr. Julie, that is one of the top gynecologists that I know in Mexico City, where she will advise the patient what is the best way to go when you have a hormonal issue. Because as women, we don't know. I didn't know about the bioidentical hormones, but we don't know either how it's affecting our mouth and our life and our happiness inside. And when a woman or a man goes into depression, what is going to happen is the mouth gets dry, they don't brush and floss. So the most important, follow the technique of brushing and flossing, but during puberty, any hormonal change, menstruation, menopause. And the last part that I want to mention is when you see an elderly person, meaning they go, now elderly person, I don't know how to define, because I see my mom is 80 something, and I see she's she's so energetic, like if she was 50, and we are not aging the same way when we stay active. So when we are older and we have disease like high blood pressure and you take medication for the blood pressure and the mouth gets dry, or for depression, or for diabetes, people with diabetes, they also get with depression very constantly unless they keep exercising every single day, watch the nutrition, lower the sugars for everyone, and keep in mind your brushing and flossing technique. That's the best way that you are gonna control your oral health, even if you go to all the stages of the hormonal changes. So if you have any questions, don't forget that you can send these questions here to our channel in YouTube, TikTok, Instagram, Facebook, and we will be happy to answer all of them. After you know this, now that you know all this, you have no excuse to have infections, inflammation, cavities, because now you know when you have a hormonal change. Of course, don't forget nutrition, exercising, but the brushing and flossing, I guarantee you the technique that we offer in the program, if you look at it, we have several shorts, several programs where I talk so much about brushing and flossing. Somebody was telling me, one of the doctors that comes to the office and is gonna be an endodontist that I love dearly, this doctor, she says, "But why you don't talk more about root canals? Why you talk too much about preventive dentistry?" Because I love doing root canals. That's my passion. I live for it. I will work until I die to doing root canals, because the root canal is gonna save your tooth. But I also feel obligated as a general dentist I was before being a specialist and have all these degrees I have. I gotta remember, I am a dentist, that our objective is not only do root canals, but also teach my patients how to save your teeth. So I hope you have fun with this episode, and I see you in the next one. Take care.